Hello and welcome to the Healthcare Huddle video podcast. I'm your host, Rachel Slawson, and today we'll be discussing the first Do No Harm, the report of the Independent Medicines and Medical Devices Safety Review led by Baroness Cumberledge. And today we'll be talking with Darren Thorne, Managing Director of Facere Melius. Facere Melius are a healthcare consultancy which offers a unique combination of insight, innovation and experience. They specialise in quality, governance and patient safety investigations. Hi Darren, how are you?
Hello Rachel, I'm fine. How are you?
I'm good, thanks. I'm really looking forward to discussing this because it's a really hot topic. So Darren, for those who don't know, should we discuss the background of the report?
Yes, this review was announced by Jeremy Hunt back in 2018 into how the healthcare system in England responded to reports from patients about harmful side effects from medicines and medical devices. Specifically in this case, it was about Primados, sodium valproate and pelvic mesh. We think, for Facere Melius, that the themes that have been identified in this report are valuable to the NHS, not just in relation to the medical devices and the medicines. So I'm looking forward to talking to you about them.
The report has 9 recommendations and 12 themes, and we're going to be discussing those themes today. Theme 1 is no one is listening, the patient voice dismissed. What can be done to ensure that patients are listened to and their concerns are properly investigated and resolved?
That's a really important question. What we've found in some of our investigations that we've undertaken is that this is a really important point and comes up time and time again. NHS organisations need to ensure that they use open listening and avoid being defensive or even appearing arrogant and inadvertently dismissing attitudes. We've seen so many instances where listening and communication can be improved. And there are things that organisations can do. For example, boards can make sure that they hear patient stories. They need to try and get some best practice to ensure that patients are genuinely listened to in every interaction across the organisation. But most importantly, boards need to have processes to understand what's happening and to set out their ambition to hear patient stories.
Yeah, definitely. And I think once you get that voice heard at that level, they can then really understand what's happening at the grassroots, because hospitals are so massive, or these organizations are so massive, it can be very easy to get detached away from what it's like to have that patient experience at that ground level. Theme 2 is I'll never forgive myself, parents living with guilt. How do you think healthcare organizations should manage situations like this?
This is always challenging. We need to recognise the overwhelming sense of guilt parents feel when tragic events occur to their children and the impact it has on their whole family. We've seen family units being really challenged in the aftermath of such events. It's important that organisations treat the families with sensitivity, ensuring that they get access to the counselling that they need and be responsive to the family needs, helping them through that difficult time, possibly providing them with independent advocacy, or where necessary, commissioning an independent report to get to the truth and to help the family understand what happened, possibly looking for missed opportunities and ensuring that as far as it's possible that this doesn't happen again and provide learning for the future.
Yeah, because you definitely don't want to feel as a patient, if something bad has happened, that anybody else has to experience that again. You want to make sure that those lessons have been learned and no one will ever experience that. Protect other parents from experiencing that potential loss and suffering.
Yes, and I feel that it's really important that parents have confidence in whoever's looking at the issues that have occurred, whoever's investigating. We'll get to the truth as far as is practicable.
So theme 3 is I was never told. That's the failure of informed consent. How do you address the issues around clinicians gaining informed consent? I know the report makes recommendations around patient aids and the use of mobile technology to record conversations between clinicians and patients when they're making decisions in their care.
So informed consent is a right that's enshrined in law and is absolutely the right thing to do. Information must be given to patients in a clear and meaningful way, and it needs to absolutely take into consideration the patient in a holistic way. The use of language is really important, and ensuring that we don't use complicated clinical terms that could be misunderstood by parents or by patients.
Yeah, we don't want anything, you don't want anything to be misconstrued when somebody is giving their consent to something that's potentially going to change their life significantly.
Absolutely. And these
Yeah.
conversations tend to happen, very quickly. They might, and I don't think patients can always remember what's said.
Yeah, it can be overwhelming, and you might have come in thinking you were, going to be okay, and the test results are going to come back with this, and then all of a sudden there's an avalanche of information and big decisions that need to be made very quickly in some cases around things that will affect you going forward. So yeah, I think that recording conversations would be really useful. You can sit and listen to those, maybe even with your GP potentially, if you've got questions beyond that, or with somebody else that might be able to help you make sense of what's happened.
Yes, I think patients need to feel empowered to be able to ask, can I record this conversation on my phone? And clinicians shouldn't feel threatened by it. It's often not done with any untoward intent of that recording. It's normally just to help the patients either play it back with their families or, as you say, their GPs, and give them an opportunity to write questions down and make contact with the appropriate clinician in the future.
I'm just jumping on here as we have split this video into 3 smaller segments for those of you who don't have a lot of time. I will add an iCard here with the next video, which covers themes 4 to 7, and the final video, which covers themes 8 to 12 in the report. I will also leave the links in the description below, along with the full-length video, which is around 18 minutes and 30. I hope you've enjoyed this smaller segment of the video and have learned a lot from it. As I say, follow us on social media, and we will see you next time.